So years ago, it must have been 10, 12 years ago, I had a family come up to me. I think they were from Europe, and I think their child had a comprehensive assessment at some world-renowned institute in London, and they told me that their child was diagnosed with autism. And I said, there is no freaking way that these kids have autism, because my experience had been all these kids are so social and they're so engaging, and it seemed to be the exact opposite of what at least my understanding of autism is. And so finally we decided, okay, let's study this systematically, and I think it was thanks to Sarah who hooked us up with Natacha, a colleague of hers, and that's when we began to initiate a systematic evaluation of autism in these children. And we're really fortunate to have Natacha here, who is a world-renowned expert in autism, and to have this kind of resource right here in our backyard to give up a lot of time to do this without any reimbursement or anything is really remarkable. And so it's a great pleasure for me to introduce again Dr. Natacha Akshoomoff, and I've got some things for her. Wine, t-shirt, gift certificate. Now let's make sure I can get her presentation up. So.
Well, thank you, and I'm going to just speak pretty briefly so we can stay on schedule, but I really want to thank all of you who are here, but also particularly those of you who have worked so hard to keep this conference going, and I know the parents have dedicated a lot of time and effort to this cause, which I'm happy to help with in any way that I can. So as Paul said, you know, I was brought in, and this is really kind of a way of discovering more about this particular genetic condition. I've been working in the field, I'm a pediatric neuropsychologist, and I've been working in the field since, I don't know, 87 or so when I was in graduate school. And our ideas about autism have certainly changed enormously in that period of time. And in the last couple years, my view of autism has changed a lot too. We have, you know, wondered a lot about this complex disorder, which I'll just give you a little overview of today. And we see many children where we don't know anything about what might have gone wrong, and we've basically labeled the syndrome of behaviors that these children have as autism. And the most common term that people use in the medical literature is of unknown etiology, which means that when we have a syndrome like autism, it's just a matter of time before people will start to kind of uncover what might be the cause. And as we've learned in the last few years, there are many, many causes for autism. So we used to think that we would sort of be able to figure out where there would be some commonality across the great majority of children with this condition, but nature is very complicated, and most geneticists agree that there are multiple causes for this behavioral syndrome, and maybe we'll figure out what might be sort of more common amongst the kids that share the same biological explanation. And so in this particular study here of your children, we have an understanding of some commonality of the genetics, and once again we found that there's a lot of variation across children who have the same condition. So I'm going to talk a little bit about what we found so far. And most of you have probably heard about autism. It's become certainly much more commonly discussed in the public, and lots of people concerned about why is it that so many children seem to be diagnosed with autism. It's a syndrome, and so basically what we look at are children who share some common difficulties, and the most there's a triad of impairments that we call autism, where children have difficulty with social interaction, communication, and what we call restricted and repetitive behaviors, and that these are outside the realm of just common variation compared to other children of that same age and with similar developmental levels. And when we talk about these characteristics, when we talk about communication skills and social skills, we're talking about difficulties that kids commonly have with using eye contact for social interaction, with facial expressions to communicate with other people, and to use gestures to communicate with other people. Now, these are all behaviors that emerge over time and change dramatically in the life of a young child. But these are some of the common kinds of difficulties that children with autism share. In terms of social communication, we're also talking about these use of gestures with other people, sharing your knowledge of the world, your observations of the world with other people. This is how young children learn, is by asking questions or observing other people, sharing their experiences, getting feedback from their parents, their teachers, etc. And when children don't seem to do that as much as you would expect, we start to get concerned. And then also, interactions with your peers. When children are very young, obviously they spend most of their time interacting with their parents and their caregivers, but as they mature, we put them in social situations, and when children don't seem to be as interested in interacting with other kids or avoid those sorts of situations, then we wonder about how they might be having difficulties and what might be the explanations. The other thing that sets autism apart from just having some difficulty with communication or with social interactions are these specific types of interests. And people have been puzzled as to why it is that children with autism seem to have these sorts of characteristics. One underlying explanation has been that they oftentimes have real difficulty with change and dealing with the unexpected. So if you have a hard time kind of being flexible, many kids seem to be a lot less anxious or more comfortable when they can kind of predict what's happening. Now, that's true for most young children. We like them to have routines. They do a whole lot better when there's a schedule and things of that sort. But we're talking about this to much more of an extreme. So the degree to which the child can't really function very well unless they engage in certain unusual kinds of behaviors, or get very upset when there's a pretty minor change in their routine, having to engage in kind of unusual sorts of rituals, and also showing characteristic unusual behaviors to an excessive degree, like repetitive motor mannerisms, seeking out unusual sensory kinds of things like having to touch certain textures or staring at things for long periods of time, having to smell things, or being very aversive to certain kinds of sensations, to the degree to which for young children it might cause a lot of feeding difficulties or difficulties with getting dressed and other kinds of things. And then some children who get really interested in certain kinds of specific interests and have a hard time being flexible, etc. So when we put these sorts of symptoms together, you know, they're very diverse and somewhat unusual, but when you see the collection of these sorts of difficulties in a child and there doesn't seem to be a good reason why they may have those things, we label that autism. What we've seen is that there's been a lot of change in the numbers of kids that are given this diagnosis, and certainly the prevalence or the number of children that receive services under this label of autism has grown dramatically in recent years. We think that it's probably because our definitions have changed. We've broadened our definition, and we've also become much more aware of how to identify these children. Historically, most children with a diagnosis of autism had mental retardation or intellectual disability, but now we also give more children who don't have more severe intellectual disabilities this diagnosis as well, which means that the numbers have increased. It used to be thought that half of all children with autism wouldn't speak or would never develop spoken language, but with recent estimates, we predict that most children with a diagnosis of autism will at least have some spoken language skills. Particularly with early identification and early intervention, we think that we've also improved those statistics quite a lot. We know that autism is clearly a neurodevelopmental disorder, but it's defined completely on the basis of behavior. There's no test, so that's why psychologists like myself and other behavioral experts make the diagnosis, which means that it's subject to lots of criticism and people thinking that, you know, there's not necessarily close reliability as there is with a specific kind of test. There's no specific biological marker yet, and it's clear that there's going to be many different kinds of neurobiological markers that are given the same diagnosis. So we assume that it results from a variety of different causes. Clearly there's a strong genetic component. And there's, as I've said, there's a range of difficulties. So some children are pretty high functioning. They may function pretty well in a regular classroom with supports. Other children who need a lot more support and interventions for a long period of time. And certainly autism is a lifelong disorder, but our prognosis is improving quite a bit, particularly with kids that are identified early and who have who are higher functioning. So this brings us to this conference and why we're here. And as Paul said, it was really just, there hasn't been any reports that we can find in the literature where people have said children with Jacobson syndrome have autism. And we were just on the verge of writing our results up, and we thought, well, let's collect some more data at this conference. So we're fortunate enough to say that we're going to have more cases that I'll be able to see and get information from, and then we'll be ready to start making our results a bit more public. What we did was we started looking at the children that came in, and I've been doing the same type of research-based assessment that I use in the clinic and in other research studies of autism to try to disentangle for kids with Jacobson syndrome how many of them really do seem to fit these characteristics of autism, and how many don't, and how do we disentangle that from some of the intellectual and behavioral difficulties that they may have. So that's my job, is I'm not trying to overdiagnose autism. In fact, I tend to be pretty conservative, where I try to make sure that we're not misinterpreting difficulties in communication or difficulties with social skills or difficulties with flexibility and just calling that autism, but really using the research tools that we have, my clinical judgment, et cetera, to say, no, this child's features really are pretty consistent with that diagnosis. So what we found is, from the data that we've collected in 2008 and 2010, there are 13 individuals that we've seen with a pure distal 11q deletion between the ages of 3 and 23 that I've seen. And prior to testing, the parents completed one of the questionnaires, a social communication questionnaire, and we had a complete clinical assessment completed on 11 individuals. We've gotten information from additional children as well. But for the children that we did the comprehensive assessment with, these are the results, and I know you don't need to read all these little numbers, but you can see in this table that for the children at the top, these are children whose IQs are pretty low, where the mean is 100 and the standard deviation is 15. For all the children that I gave a diagnosis of autism to, they met criteria on the Autism Diagnostic Observation Schedule. Their parent information from the questionnaires indicated significant number of symptoms. And so that's pretty remarkable, because in this group of children, even if we expand it to all the kids that we've at least gotten a questionnaire from, that rate of autism is higher than we would expect just if we took a group of children randomly, and we sort of have an estimate of how many kids should have autism in the general population. So we've begun to see that there seem to be more children with Jacobson syndrome who seem to meet criteria for autism, who have these characteristics, but not all children do, but more kids than we would expect. Some of the children who have many of the symptoms but maybe don't meet full criteria, and then you can see that there's a group of children whose parents did not endorse a lot of symptoms, who I saw with the ADOS, and who I felt did not meet criteria for autism either. 6 individuals met criteria for autistic disorder or PDD-NOS, and as I said, 28 of the children that we've seen in San Diego the last 2 conferences. Their parents completed the SEQ, and 16 of those kids the parents reported a significant number of symptoms. So that's pretty high, that based on parent report and with clinical reports, that we have quite a few kids where they seem to meet criteria for autism. Just a few words. So for those of you who have a child that we saw or who have sort of strong suspicions about or concerns about their social abilities, their communication abilities, or some of these repetitive interest and restricted behaviors, what do you need to know? So certainly there's a whole variety of interventions for autism, and many people, as I said, don't necessarily know what might be the underlying cause for their child's autism, but it doesn't really matter, because the approaches that are used for helping children who have these sorts of characteristic behavioral issues are all the same. The primary, the most important scientific-based types of interventions are educational and behavioral types of interventions. These are delivered through the schools as well as through private therapies, and there's more insurance support for those with the new laws in many states more recently, fortunately. The types of interventions that really seem to have the most impact are behavioral, developmental, and more relationship-based for improving social interactions, etc. And people talk a lot about ABA, which is really applied behavior analysis, a division, if you will, of psychology founded on experimental analysis of behavior. And these are, so I'm not going to go into all this detail, but basically the types of interventions that seem to work best for kids with autism are based on the principles of behavior support. So for improving, for increasing positive behaviors and decreasing positive behaviors using rewards and other sorts of approaches that can be applied at home as well as in the schools. So when people talk about ABA interventions for children, it's really an umbrella term for a lot of different types of strategies. And most of the most effective strategies are based on these principles. So people will talk about discrete trial training, which is typically used for younger children in an individual type of format. Here in San Diego, we use a lot of pivotal response interventions, which are more naturalistic types of interventions for children. For children who have not yet developed spoken language, we can use a more symbolic or picture exchange communication system that can be applied at home as well as at the schools. And the thing about it is that all of these sorts of techniques are helpful for many young children, not just children with autism. And it's painful to me that, you know, sometimes children are not given these sorts of interventions because they don't have the diagnosis or they haven't gotten the right sorts of interventions. But we find these strategies particularly helpful for kids with autism who may not respond to the typical kinds of interventions in speech therapy and special education, etc., because of the difficulties that they have. And then this is just to show you some other types of methods that people talk about. The bottom line is that, that we see the most favorable outcomes when these sorts of ABA programs are started early in life and implemented more intensively. So the literature says 20 hours or more per week for 2 or more years, and this is certainly a source of a lot of debate and contention when families hear this and they know that their child is having a lot of difficulty, to what degree they can get that intensity of service. But certainly any types of services that your child may need that are more specific and targeted in an individual way, if your child is having these sorts of difficulties, is really important to try to get as early as possible. And when people talk about autism, there's also a lot of confusion about what are the labels. And so people use the term autistic disorder, Asperger's disorder, or PDD-NOS, and we don't have good consistency across clinicians in making these diagnoses, and so people are turning now towards just calling it autism spectrum disorder and being more specific for each individual child if there is agreement with the DSM-5 to specify whether or not the child has intellectual disability, other kinds of medical conditions, what their functioning level is dependent on their age, etc. So you're going to hear more and more people just talk about autism spectrum disorder, and that's why. So people have certainly more recently said, you know, it's probably time to give up this idea that there's a single explanation for autism. There's many different explanations, and we're trying to figure out a little bit more for the kids that have Jacobson syndrome. What is it about the children who seem to have many of these characteristic features of autism? What's different about them? Maybe it's something about where their deletion is, or maybe it's additional factors that we need to understand a little bit more about, which helps us to learn more not only about Jacobson syndrome, but also about autism as a broader disorder as well. And certainly my role, not only as a researcher but as a clinician, is to help people get more information about accessing services for their children. So if you have specific questions after we have our discussion, I can give you a little bit of advice about getting specific services in terms of education, social skills, promoting daily living skills, and personal safety concerns. And that's it. Thank you.